Welcome everyone. I am here today. I'm Mele Look with the University of Hawaii Department of Native Hawaiian Health at the John A. Burns School of Medicine. And I'm here talking with Dr. Landon Opunui. So Landon holds significant leadership positions at Napu'uwai, a Native Hawaiian healthcare system serving the rural islands of Molokai and Lanai here in Hawaii. Dr. Opunui serves many important roles, significant roles, including executive director, medical director, and the naturopathic physician at Napu'uwai, and is implementing his organization's vision to blend traditional Hawaiian health views with modern medicine practice. He and his team have pioneered the development of a Native Hawaiian integrative health center, which offers that culturally responsive healthcare services and education. So I've known Landon for many years and admired his work and his progress. And outside of his clinical and leadership roles in healthcare, he is known as an elite athlete for many years. And presently, his sport of choice has been competitive outrigger canoe paddling in individual and group events. And we'll be talking a bit about both of them today. So thank you so much, Landon, for joining us.
Mahalo Mele for having me, and I look forward to the opportunity to share a little bit about my life, maybe through the lens of paddling as a cultural activity, as a physical activity, as a spiritual practice. So the three different areas that I would like to share with our time today is a little bit about my personal background, my professional work, and systems transformation in the larger healthcare delivery aspect of the work that I do. And I am framing all of this through culture as a strength, not as a risk factor. So I like to say that I was either destined to have a big belly myself with a last name such as Opunui, which is the literal translation, or I was destined for a career in healthcare. So although I am working really hard on the former as a relatively new father and preventing the whole dad bod thing from creeping in, I do very much think that I was destined for healthcare and am so fortunate to have the platform of Native Hawaiian healthcare, which is a huge passion of the work that I do today. So from a Hawaiian worldview, foundation is really important. And core and central to my foundation is my identity as a Hawaiian, and where I come from. So one of the important kupuna pillars in my journey that has really been an important catalyst for the work that I do and the legacy that I hope to perpetuate is my Hawaiian grandmother, Eleanor Opunui, who tragically and unfortunately is one of the statistics that we all know too well in Native Hawaiian health. She died way too prematurely at the age of 51 from cardiac arrest. And I never had the opportunity to meet her. And as what would have been an important matriarch of our family who introduced me to Hawaiian language and our cultural practices and Ike Hawaii, that was largely absent in my upbringing and was a huge void. And part of my journey, my personal journey and my personal transformation is listening more closely to that which is often unheard or unseen, because that wisdom, that guidance is still very much palpable if you just plug in and you pay attention. So this image here in the center of the screen, I think is so beautifully emblematic of our kupuna, guiding us in our times of strife, in our times of struggle, when we feel overwhelmed, when we fall down, when we are exhausted as we paddle our canoe across channels between islands, and we need their assistance. We need their guidance. So what came quite natural to me, and something that I had more easily accessible to me, was hoiva, or outrigger paddling. So I consider outrigger paddling my first cultural practice, and I gravitated it to it quite naturally, because I was attracted to being in the ocean. As a young kid, I just wanted to take every single opportunity that I could to be in the ocean. And because I don't come from a waterman family, outrigger paddling and club paddling was a really safe and structured way for me to do it safely. And I just love the competition and the complexity of the sport. If you don't know much about outrigger paddling, I like to describe it through the lens of 4 or 5 different pillars. You have the cardiovascular nature of the sport, whether you're sprinting or doing a long distance race. There's a strength element, there's a technique element, there is a skill element, especially when you get out into the big ocean conditions and you can start surfing wind swells, and can be strategic with the different line you take from point A to point B. And then during the longer races, of course, you have the nutrition component, which is necessary to make sure that your body is properly fueled to do 2, 3, 4, 5+ hour race. And what I kind of grew into over the course of my career, in this cultural practice, in this sport, was a much deeper appreciation for the elements that are ever present around us. And I probably enjoy most being on my one-man canoe, in large part because I can go whenever, wherever, at my own pace. And because Kailua Bay is my backyard, and we have onshore winds, what I typically do is I paddle 3, 4, 5 miles straight out to sea, turn around, and then I have the wind at my back and I can surf. I can surf in. So when you're out there by yourself, this drives my wife and my parents crazy, because anything can happen out there. I prefer to not have any devices on me, and just to be in my own head, to be in my own body, to just have my va'a, to just have my paddle. And you are deep in kaloa, and in that space, you hear the whispers of your ancestors, and the insight and the clarity becomes so much more clear. So that's what I mean by outrigger paddling as not just a sport, but as a cultural practice, as a self-care practice, as a spiritual practice. And with the busy life that I now live as a parent, as a healthcare administrator, as a practicing clinician, and trying to maintain my own health and well-being, I don't have a whole lot of free time. So outrigger paddling checks so many of the boxes. It gets me outdoors. It helps me maintain my fitness. I'm still hungry to be competitive, so it helps me stay sharp and working hard. And it's you just have the community around you. You have the elements, and it's one of those physical activities that you can stack so many different benefits with, and you are rewarded. This is a beautiful double rainbow. I was fortunate to have my camera or my cell phone with me on this day, and it was just too beautiful for me to not stop snap this picture, because I don't think anyone would have believed I saw something so beautiful on this day. And my journey to Olelo Hawaii, my journey to cultural practices, my journey to deepen my appreciation for Kanaka Uivi has grown over the years. And I'm going to talk a little bit more about my professional work, but this is a deeply personal thing for me, and that is learning about our traditional healing practices. And I've come to learn that when you are ready, the kumu appears. And I've been so fortunate to have many great kumus over the course of my journey, who have really helped put into place the important foundation of Hawaiian health worldview and our concepts of Mauliola and the importance of healing, not just managing health, but truly healing. And that journey continues. And the many different roles that I carry with me all are kind of blended into how I show up authentically. And it's hard to separate things when all of my life experience is what makes me who I am today. So from an early age, I knew that I was interested in medicine. I studied hard at Kamehameha schools where I graduated from. Wasn't didn't graduate at the top of my class, but I worked hard. I liked science, um, and I liked human performance. I've been an athlete my whole life, and it was very clear to me at an early age the impact that sleep and nutrition and how I trained influenced my performance as a paddler, as a runner, as a water polo player, all the different sports that I played. And that is kind of the motivation that propelled me into an interest in pursuing medicine. So while I was studying pre-med in undergrad, I had the opportunity to shadow a couple of family medicine physicians. And perhaps my experience would have been radically different if I had instead shadowed Dr. Blaisdell or Dr. Carpenter or Dr. Aluli, some of our Native Hawaiian kauka pillars. But the experience that I had was very transactional. Um, the doctor saw the patients for 5, 10 minutes at most. Um, the communication was straight to the point. What's wrong? What's the diagnosis? What's the drug that the patient needs in order to manage this condition? And I think I got a bit disenchanted with this career path because of that exposure, and realize that allopathic medicine or biomedicine wasn't quite the best fit for me in what I wanted to do, which was an emphasis on treating the cause of disease and incorporating lifestyle as a powerful medicine to prevent disease, to stabilize health, and to even reverse disease in some cases. So it just so happened that I was kind of randomly introduced to the profession of naturopathic medicine. And if that's new to you, this is kind of the elevator speech that I like to give people. Naturopathic medicine is a system of medicine that combines both natural medicine with modern medicine with the goal of restoring and optimizing health. So philosophically, that aligned much better with my values, the way I viewed health, and the principles of naturopathic medicine resonated quite deeply with me. That is to care for the whole person and to understand the stories that each of us carry with us and our lived experiences that help shape who we are today, to prevent disease, to heal through the power of nature, to function as a teacher. The word doctor comes from the Latin root docere, which means to teach. So a good doctor should be a good teacher, and we should improve health literacy in the patients and the communities that we serve. First, do no harm is a pretty consistent tenet throughout all practices of medicine. And what I have highlighted here is what probably drew me the most to this profession. And that is an emphasis on identifying and treating the cause of illness or disease. So when I first started practicing medicine as a naturopathic physician, I was very, very naive. I overcompensated and had the impression that if we just reduced refined carbohydrate consumption, and every one of my patients who had type 2 diabetes, it was simple. We would better manage blood glucose, and we can reduce a patient's medications, and they would have a much better quality of life. I thought most of chronic disease was simply the byproduct of not optimizing our lifestyle. And in the real world, I soon realized that there are many different things that influence the lifestyles that we live. And as I peeled back the different layers of the onion in Hawaii, and particularly in my Native Hawaiian patients that I served, it became quite clear to me that at the core of much of the downstream health disparities that we see, particularly in Native Hawaiians, upstream are the impacts of colonization. Um, the devastating impact of foreign disease, where 80+% of the Hawaiian population was decimated, the loss of land, the overthrow of our sovereign governance, military occupation, the destruction of our aina and natural resources, and the loss of our self-identity as a people, our language, our cultural practices, the way in which we built relationships with the elements that surrounded us. And when we look at the modern day health status of Native Hawaiians and many other vulnerable populations, we see that a lot of the health disparities are a result of many, many complex variables. This is from the work of Dr. Kiave at the Department of Native Hawaiian Health, which you know quite well, Mele. And I like to use this slide because it highlights the many different variables that have an influence on the downstream health factors. And this left column, of course, are the historical determinants of health. We know that there are cultural determinants of health, there are political determinants of health, and what most people learn in their training when they go to school are the social determinants of health, and all of those things and their interconnectedness largely creates an environment that makes it very, very difficult for people to thrive. This is a public health slide that is commonly used in presentations. And I like to use it when I talk about systems transformation, because when you look at the bottom of this diagram, the best practice of healthcare only influences health at a population health level by 20%. And I think we have a far way to go from even the best practice of healthcare delivery, healthcare that's accessible to all. So we know that our health behaviors have a huge influence on our health status, the physical environments in which we live, and then, of course, all of the socioeconomic, historical, political, cultural factors that help shape the environment that we live in today. And this isn't a new or a novel concept. In all of the brilliance of our kupuna and those who come before us, this is, I think, a very poetic way that succinctly describes everything that I just shared. Mohala I ka wai ka maka o ka pua. A flower can only thrive in a living environment that is healthy. So from a systems change perspective, the question then becomes, what has shaped the environment that we live in today? Is it an environment that allows all of us to thrive in an interdependent way? And if not, how do we reshape that environment to make progress? So at Napu Uvai, we are a Native Hawaiian healthcare system, and our goal is to provide culturally responsive healthcare. We recognize that you can't just plop this cookie cutter community health center in a rural, predominantly Native Hawaiian community and expect trust to be built overnight, community to access care, and for health outcomes to improve. So what we are working towards as a Native Hawaiian health system is to enhance the experience, trust, and access for Hawaiians, to support health comprehensively through a Kanaka lens, to provide culturally and community grounded care by Hawaiians and through allies, incorporates our traditional practices and blend them in ways that are respectful and appropriate with our Western healthcare services, and to ideally create a healthcare delivery model that moves the needle on our health outcomes. And this kind of multifaceted approach that draws on different knowledge bases, again, is very much aligned with the ike kupuna of those who come before us. Ohe pau ka ike I ka hala ho'okahi. Not all knowledge is learned in one school. And I would argue, based on my entire career working in integrative medicine, working alongside medical doctors and PAs and nurse practitioners and clinical psychologists and acupuncturists and physical therapists, and I can go on and on and on, there is actually more in common than what many of us perceive. And I think the core thing that is at the center of what we all have in common, we all have a vested interest in improving the health of the patients that we serve, the families that we serve, communities that we serve, and the lahui that we are all working to support and advance. So our model of healthcare delivery is focused on integrative clinical care. And again, that blends both primary health, which is primary care, behavioral health, nutrition counseling, with what I call TCIM, traditional complementary integrative medicine. So that's our traditional healing practices, that's naturopathic medicine, that's acupuncture. And we work in an interprofessional capacity, one of shared respect. And our model has been working quite well for us. We also understand the importance of education and to equipping those that we serve with the different lifestyle tools necessary to adopt new cooking techniques and to initiate a new exercise program. And we embed a lot of our health education programs with Hawaiian values, with that important cultural foundation. And the Department of Native Hawaiian Health has done amazing work with the development of their Hula for Health program, their Pili program, and we actually have adopted many of those programs and have kind of tweaked them in a way that is appropriate and resonates well with the unique communities that we serve. And then the third pillar is to not just limit our engagement with community to the patient exam room or through health education programming. We want to go out to the community. We want to share what resources are available. We want to go to community. And that is something we do through a really robust outreach arm of our organization, and where we take a lot of different community resources out into the community. And collectively, we hope that this model improves health outcomes in advance of our vision, which is to help create opportunities and to help reshape an environment where we can all thrive interdependently. So I am going to close with this. This is a metaphor that I commonly use to take a very complex concept, such as mauliola, or optimal health and well-being through a Native Hawaiian lens. Imagine you have an umeke, or a bowl. In that bowl is vai, or water, which represents our mana. From a Hawaiian perspective, when we become ill, our umeke has a crack in it, and our vai becomes depleted. And as a result of that, we become sick. So the act of healing is about two things. It's about taking a peva and mending those cracks. That's the process of healing, while simultaneously understanding what innately gives us mana, what energizes us, what gives us the vitality. How do we optimize our own self-care? And when our umekes overflow with abundance, when vai is flowing out the top of our umeke, that is mauliola. And we acknowledge and understand that for us to collectively thrive as a people, as a community, as a place, it's not just about individual mauliola. It's about the mauliola of our families. It's about the mauliola of our communities. It's the mauliola of our lahui. So with that, I'll turn it back to you, Mele.
Th- Thank you, Landon. That was inspiring. That was informative. That was a great pathway of your journey. Um, I was very intrigued and very intrigued, right, about this goal of blending the Hawaiian perspective with the modern clinical practices. And and your three pillars of treat, educate, and outreach. Can you provide an example of something you're particularly proud of or that you've seen on Molokai or Lanai that you feel really impressed by or encouraged by that is actually doing it right?
Yeah, I'll be happy to give you an example, and I will use a kind of a physical activity specific example because of the context in which we are having this conversation, and that is through uh, the rebranding of the gym that was attached to our organization quite peripherally, and we renamed it and better integrated it into the organization by calling it an integrative fitness center, which has now moved from a warehouse outside of Kaunakakai to a central location on our main campus at Kulana Oiwi. And our purpose of utilizing this tool or this resource is multifold. As a naturopathic doctor, as an athlete myself, as someone who understands the research and the science, it is quite clear that movement is very, very powerful medicine. So we recognize that access to fitness classes, access to cardio equipment, access to strength training equipment is medicine. And we should recommend that to our patients. We should provide them with some support. And what we did as kind of an innovative initiative is we allowed our primary care patients complimentary access to our fitness center if they are successful at closing their healthcare gaps. So if they come in once a year for their annual exam, if they meet all of their um, cancer screening guidelines, then they get all of their check boxes completed, and in exchange for that, they get complimentary access to our fitness center. Additionally, we have a large portion of our community who only engage with us as an organization through our integrative fitness center. Perhaps they have a primary care provider elsewhere. That's perfectly fine. That allows us to support community beyond just clinical services, and it's a powerful tool for prevention. And like we need to remember, we don't just start managing our health when we become sick. We should be doing that as early as we can in our life and make that become an important part of our daily living so that we can prevent and delay the onset of these chronic health conditions and improve our quality of life along the way.
That's wonderful. That's wonderful inspiration and how you can tweak those little changes to make it bigger and bigger changes and that the then it becomes the lifestyle. Um, I think we're about ready to close our time, but I did want to make a comment on your name because, as we know in Hawaiian language, there's at least four layers of interpretation of any name. Um, and Opunui literally may say be referred to a big stomach, but in the kauna or the underlying meaning, as you know, it refers to someone who has great wealth, right? Great abundance, and that represents who you've become and who you and the family you come from, who have great abundance and share it so generously. So thank you so much, Landon. I am inspired to see you, especially on Molokai, because I know the legacy of healers that are there. And in modern times, Dr. Aluli, Emmett, and Bill Thomas, Herbert Ho built great, great inspiration for not only Molokai, but for all of Hawaii and throughout the world. So I see you moving that direction too. So mahalo nui to you and to Teen and for providing us this opportunity to spend time together.
Mahalo nui.